Well, if you love red meat, you may have to pay more in the coming months as the country is battling an outbreak of foot and mouth disease. At the moment, there are efforts underway to try and permanently contain this outbreak. In the last few days, in fact, we've learned of a big outbreak, if you will, at a particular site, a facility owned by Karen Beef, where they're known to slaughter about 2,000 cows daily, according to some reports. One of the country's biggest feeding lots, it's based in Heidelberg. Let's bring in Dr. Maja now from the Health Department. She's the Director of Animal Health within the Department of Agriculture, Forestry and Fisheries, pardon me. Good to have your time, Dr. Maja, on the SABC. Are we dealing with a big problem here in terms of a foot and mouth disease outbreak?
Yes, good evening to you and to the viewers of SABC. We are dealing with a big outbreak, but I need to also hasten to correct that we will not be facing any shortages of meat. I love my meat, so we do make sure that we still have healthy meat on the shelves.
And how, you say that with certainty, does that mean that there isn't any risk at all at some point of running short on beef, be it in a few months, etc.?
The fortunate thing with foot and mouth disease is that it does not kill animals. So we will still be having the relatively same number of animals presented for slaughter for local consumption. So I don't see any shortages in the near future of beef. And
I mentioned the Karen Beef situation. This was last week, where they are reported to slaughter about 2,000 cattle daily. Has the outbreak at the Heidelberg facility, has that been completely contained?
Not at the moment. It's going to take us a bit of time to contain it. The feedlot and other infected properties are placed under quarantine. So for now, that specific establishment cannot slaughter. But there's a whole lot of other facilities that they own where they can source the meat from that can be made available for slaughter. But there's also other producers in the country.
And where is the department then on the call from some people in the industry, some farmers, for the declaration of a state of disaster in response to this outbreak?
I'm not so sure that we can declare it a state of disaster at this point in time. There's a whole lot of connotations to a state of disaster. I don't think we are there yet. Yes, this outbreak is big, but we are putting our heads together, both the national department, but also the provincial veterinary authorities and industry, to contain it. So I don't think it is a state of disaster.
What does that mean? Where does it leave us in terms of countries that have already basically imposed restrictions on their beef imports from South Africa? I know China, I think, has taken issue, as have Namibia and Zimbabwe. What will it take to have those lifted?
We need to demonstrate to our trade partners that we have the situation under control. We need to also conduct some limited surveillance to demonstrate that there is no circulating virus in the country. And those are the things that we will be taking up as the department to reassure our trade partners that we have contained the outbreak. There is no risk in products that we export to them.
And do we know, Dr. Maja, the true extent to which foot and mouth disease may be present among herds in the country?
It is for that reason that we want to conduct countrywide surveillance. So a quick answer is no, but at the same time, foot and mouth disease does manifest itself. So there is very less likelihood of us missing it if it is present anywhere else in the country. And we have been receiving reports of suspect cases. Samples have been collected, and the majority of it coming back negative. So I don't think there is reason for concern.
And on that note, then, let's maybe speak to people who may even themselves be small-scale cattle owners, herders, etc. What should they be looking out for, and what does it mean for an animal if we're saying a cow or a sheep, in fact, is suffering with foot and mouth disease?
The reason the disease is called foot and mouth disease is because it presents with sores in the mouth. So there will be a bit of salivation that your animals would be showing. It will have difficulty in eating. It will look like it's chewing something that you don't quite understand what it is that it's chewing. But it also presents with sores in the hoofs, so there will be a bit of limping. So whenever you see any of those signs, please call on anybody from the Department of Agriculture, especially the veterinary services, so that we can come and investigate. The unfortunate control measures for the farmers is because we don't want this outbreak extending to the rest of the country and affecting larger areas, we will place those areas under quarantine. We will then come in and vaccinate, and then from then on do the other necessary control measures depending on what the owner of the animal would want happening to those vaccinated animals.
We've gone through this multiple times, you and I, over the years. When there have been these foot and mouth outbreaks, there's always the question about the impact on people, potential risk for people. Let's address that one more time.
I actually love that question because I love my meat. The disease is perfectly safe. It does not affect people. It only affects cloven-hoofed animals, so that would be for your domestic animals. That would be your cattle, sheep, goats, and pigs. It doesn't affect people. So the meat that you get on the shelves, the milk that you get is perfectly safe for consumption. You'll not get sick from foot and mouth disease.
Thank you for that, because I had a very stressed out producer who wanted me to get that question in. I think she's about to do her monthly grocery shop. And then in terms of the vaccination, 900,000 vaccine doses, I understand, have now been ordered. The first tranche due to arrive within days. When exactly will that be? And how soon after arrival do we begin to vaccinate the animals?
I was actually in contact with Botswana this afternoon. We will be receiving vaccine early next week. And as soon as it clears customs and it is received in our warehouse, depending on logistics to take it to the field, vaccination will then start. So, for example, facilities or properties that are in Gauteng will technically literally be vaccinated the next day because it's just a stone throw away from where the vaccine will be received, and dispatch will therefore be, wouldn't take long.
Dr. Mpho Maja, always good to talk to you, Director of Animal Health with the Department of Agriculture, Forestry and Fisheries.